Health Check is presented by
Island Cancer Center.
29 million Americans are diagnosed with type 2 diabetes, and the numbers continue to grow. On Guam, diabetes is the fourth leading cause of death, but the good news is that it is manageable. Mountain Pacific Diabetes Outreach Project Manager James Roberts.
But in order for people to manage it, number one, they have to know they have it. They have to see their medical professionals. They have to take care of the diet and be on some kind of an exercise program as well as taking medications as prescribed.
95% of all people with diabetes are type 2 diabetic, and the diagnosed are getting younger and younger, and what used to be only seen in people between 40 and 50 years of age is now being seen in elementary school children. Why is that?
Well, primarily diabetes, poor diet, a lack of movement, lack of exercise. In fact, because so many of our young people spend most of their time in front of a TV screen, a computer screen, or a cell phone, they're not getting out and they're not moving. And sedentary lifestyles are a perfect breeding ground for type 2 diabetes.
If you have a family history of diabetes, then the risk of developing diabetes is increased. But there are a number of things that can change that.
You know you're at elevated risk, so you should be doing the things that you should be doing in terms of the nutrition, counting carbs, counting calories, knowing what a portion size is, and getting at least the 30 minutes of exercise a day.
But what happens if you are diagnosed? Well, according to Roberts, first thing to do is research. Find out what it is and how it affects you. More importantly, follow your doctor's advice and take your medications when you need to. Program Coordinator Gina Rojas.
Adjust your diet and your nutrition, and as James just said, your exercise habits. To get active at least 30 minutes a day is recommended.
Right.
Make sure you monitor your blood pressure as well, because that can lead to a whole other list of conditions. And really to know what your A1C number is.
Your A1C number will provide you an average of what your blood sugar levels are, making it easier for your doctor to adjust medication or recommend any other treatments.
There are a number of medications that people with diabetes can take. And of course, not any one medicine is going to be good for everybody. A lot of people will start out on pills. Some people will need to start on insulin. Again, that's something you have to do in conjunction with the advice from your medical professional.
Rojas adds that there is a way to manage your diabetes by successfully changing your habits, lifestyle, and better manage your disease so that medication is no longer needed on a daily basis. With this week's Health Check, I'm Asha Robles.
Health Check is presented by
Island Cancer Center.